Hey, good morning, everybody. Sarasota Tim coming to you from Panera Bread right here in Boynton Beach, Florida, where I'm on the SIP Club. I get free drinks for 2 months. I'm down to 1 month now, but it's a nice iced coffee right here. Saved myself at least $3-4 from going to Dunkin' Donuts. I wanted to talk to you guys this morning about Medicare. And if you are approaching the age of 65 years old and you're thinking about Medicare, it's very important that you listen to this video and take the advice I'm going to give you, because you don't want to miss it. You don't want to mess this up. So when you become 65 years old, and whether you're on Social Security or not, if you have some kind of medical insurance with your job, in order for that to count to avoid being penalized in some kind of way, your company insurance has to be a creditable insurance company. So if you quit working and you're getting a COBRA policy, or you're paying for your own or something like that, it's not going to help you. You have to have an insurance policy with a company that has at least 20 full-time employees. So you want to consider getting on Medicare. So let's move past the situations of what you have and what you don't have to what is Medicare and which one should I get. And there's all these different plans, and the TV is just loaded with commercials of people promoting these washed up actors, I call them, that are promoting the Advantage plan. And should you get the Advantage plan? And I'm going to tell you right now, when you become, if you're already drawing your Social Security check, as I am at 62 years old, and that's when you should start collecting your Social Security, please check out my video as to why you need to start drawing your Social Security for every reason except one. That's if you're super rich and making a lot of money. But and also, if I could just pause for 1 second, I always forget to do this in my videos. If you would be so kind to give my video a thumbs up and subscribe to my channel for great content, I would really appreciate it. You can wait to the end of the video to give me a thumbs up to determine whether it was worthy or not. I don't ask you to do that now. But if you've seen other videos and you do that for me anyway, go ahead and do that. So let's get back to it on Medicare. So when you are getting your Social Security, which we already said you should be getting if you're past the age of 62, now comes along Medicare, your health insurance. So the government will automatically have you enrolled, if you're already getting your Social Security, in Part A and Part B. Now, why they break it into two pieces like that and call it A and B, C and D, and E and F and G and all these things, I don't know. But I can tell you there's only 4 parts of Medicare to concern yourself with. And that's original Medicare, A and B, Part C, which is the Advantage plan, and the 4th part is Part D for your drug plan. So getting on Medicare, they're going to start taking $165 or $70. It goes up and down a couple of dollars every month right out of your Social Security check. So you have to pay that. But you need more. It's not enough, because if you get original Medicare, which you're automatically enrolled in, the Part A and Part B, and they take their $165 out of your check, you are still responsible for a copay and a deductible amount that on the Part B can be a no-ending amount. So now let's go to C. We hit A and B. A and B is not enough. We need more. So before I get into the supplement plan, let's go right to the letter C to keep this simple. A, B, C. C is the Advantage plan. C is a plan that the federal government farms you out, and you see all those commercials on TV. Get the Advantage plan because you get silver sneakers, you can go to free gym memberships, you get a free dental, vision, hearing, and all these bonuses. Don't be fooled. Don't be fooled, folks. Your medical insurance is what you're really wanting. You don't care about getting an eye exam, because that's all it is. You don't care about going and getting a couple of cleanings a year, or an x-ray for your teeth. And even dental insurance doesn't cover much. We all know that. I don't understand dental, but there's no real good coverage. And the gym membership, don't let your policy you choose base you on being able to go to different gyms for free. They got gyms for $10 a month. That's what I pay. Okay? So we're going to talk about the Advantage plan. And then there's that D, the drug plan that you have to take. It can be included in the C plan, the Advantage plan, with those silver sneakers and the vision and the hearing and all that. You can even get a drug plan in that. But if you take the original Medicare that you're going to automatically be enrolled in, and then you apply for a supplement plan or a Medigap plan to cover all the cost, which I want to talk about right now. I don't promote Medicare, Medicare. I don't promote the Advantage plan any longer, except for a few rare reasons. We'll go over that in a minute. What I promote right away, just so we get to the meat of this video, when you get Medicare and you're getting your A and B automatically because you're already getting your Social Security, remember you need to draw that Social Security at 62 years old. Don't wait. You've already got Medicare Part A and Part B, so you're not stuck with paying co-pays and additional fees because it only pays 80% of doctor fees and things. You're responsible for 20%. You got to purchase a Medigap plan, a additional cost you money plan. It's going to be a letter called G. You're going to want to get the G plan, or you might want to get the N plan. The N plan is the G plan with a little less, and you might want to get the G high deductible plan. I might make another video on that one later because that's kind of getting out there. But just to make sure, when you get your Medicare and you are on Part A and Part B, and you need to go ahead and get that Medigap supplement extra insurance to cover that 20% that you're not responsible for, that's going to cost you $100, $125, all the way up to $250 depending on the state you live in. What you have to do is you have to just Google Medicare and contact anybody you want and have them search your zip code for companies that offer the Medigap insurance that will take care of that 20% that's going to cost you that $100 to $250, and make sure they find the cheapest company in your zip code. Because you see, it doesn't matter what company it is, you just want the cheapest company, because the plan, the G plan that I'm going to talk about, is a standardized plan. What that means is the government says the G plan, whoever sells it, has to be exactly the same. All the medical coverages are the same. So whether you're with Aetna or Humana or AARP, which is United Healthcare, you're going to get the same coverages, but they might sell that plan at a different price. And after you get a plan and you've been on it for a year, you might want to have your agent also check to make sure another company isn't charging less, and so you can switch during the open enrollment period from November 1st through January 15th every year. And like I said, it's the same standardized plan. Why pay $40 more for somebody that, is doing the same thing? So always keep an eye on that every year. Some people get the G plan and subsidize their A and B, and it's the best coverage, but it can change over time. So you're going to get the G plan, and the G plan is basically going to give you the carte blanche, the Cadillac, the limited, the best coverage, because what it does is it allows you to go to any doctor in America that accepts Medicare, which is 99% of them, and you don't have to worry one bit about costing you any money, with the exception of $226 or $233. It changes every year, $2 or $3, but it's never going to go up $2,000. In fact, last year it went down. There's a deductible that the G plan has, that every year, January 1st, it starts over, that when you go to the doctors, the unpaid balance, the first $233, is something that you have to pay. So be prepared for that. But after that, there's not going to be another penny out of your pocket. So that's the good news. And then also, if you have the N plan, it's the G plan, but it has a little bit lower cost. So I would say this: if you get a price, and definitely get a price for the G and the N, if the N plan is only $25 or less difference, lower than the G, just get the G, because everybody's going with the G. Half the people, I shouldn't say everybody, because half the people in a growing percentage, because they're being talked into it, is getting that Advantage plan. Let's talk about that now. So we went from the Cadillac, the no other cost, other than it's going to cost you up to $200 a month on top of the $165 that they're taking out of your Social Security. So now you're basically $350 a month out of your Social Security that you are paying. So let's say it's a $200 a month supplement plan that I would be looking at here in Florida, because that's about what it's going to cost me. That's $2,400 a year, whether I go to the doctor or not, just to have the G plan. But I never have to worry about anything. It's basically, you know, other than that it's either $226 or $233. I'm forgetting right now, that deductible, that one little deductible that you get every year. So you pay the $150 to $200 a year for the G plan, and then you have that one deductible. After that, everything is paid. Don't you worry about a thing. Oh, except your drugs. You have to take out another policy, that D plan for drugs. That means D for drugs for your prescriptions. So you would have your insurance person that you talk to about Medicare, you would tell them what drugs you're taking currently. You might be able to get one of these plans for $5 to $10 a month that covers like blood pressure and cholesterol pills. But if you're a person like me that has glaucoma, and I take these drops that are $300 a bottle for a little bottle that big, I might be looking at $30 or even $35 for a plan D that would be, you know, something that would cover those eye drops. I wouldn't want to be facing $366 for some eye drops. So definitely tell your insurance agent to check what prescriptions that you're on currently so that you can get the lowest cost. So now you've got that. It's $200 a month for me for the G plan in Florida currently in my zip code, and I'm looking at $5 to $40 for a drug plan. So I'm $225 roughly, plus my $165 they're taking out of my Social Security for A and B. So what does that come up to now? $225 and $160, you do the math. It's a lot of money. And you haven't even gotten sick yet. That's why the Advantage plan is very desirable, or a lot of people entertain the idea, because the Advantage plan, they can include no additional premium other than your $165 they take out of your Social Security for A and B. And it can include those things I talked about earlier with dental, vision, and prescriptions, and gym memberships. So they have these movie stars and stuff, these washed up actors I call them, promoting it. Why are they promoting it so hard? That's because these insurance companies on the Advantage plan, now listen to me carefully, this is the disadvantage of a lot of Advantage plans. Although they're mandated to cover the same things that the original Medicare covers with the standardized coverages you get on the G plan, it's not really true, because they get $1,000 or more a month from the government, these insurance companies, subsidized to give you your medical through them. So they make the decisions. If you have a regular A and B original Medicare plan with a subsidized or a Medigap policy that is a standardized G plan or the N plan, stick with G right now, and the doctor says you need a cortisone shot, or you need this, or you need that, Medicare is going to pay for it on his word. If the doctor tells you you need something simple like that and you have an Advantage plan, what could happen is he has to contact, they have to say, well, we got to get prior approval from your insurance company. And then they decide whether it's warranted or not, or whether they want to cover it or not, because they want to keep those high profits that they're getting from the subsidy from the US government. And insurance companies always look for reasons not to pay. We know that with life insurance. We know that with auto insurance. They're in the business of not paying. They're in the business of collecting. So why does the government subsidize them and have them offer the Advantage plan? It's because the government also gets a little break on paying for all this medical. Instead of everybody being on 100% of everybody on, that's retired, getting Medicare on original Medicare with a Medigap plan, even though they're paying an insurance company to cover the 20%, they're covering literally everything. I mean, any kind of major illness, you're going to be covered. So it's really the way to go if you can justify the money. Or if you think you might become ill. You may be perfect health right now, but you don't want to gamble that something could happen to you as years pass. And if you have the Advantage plan, like I said, anytime you go to the hospital, there's a limited number of days you can be in there before you have to start paying for the hospital of $200 to $300. CAT scans and those things like that are not included, you have to pay for. And skilled nursing like rehab, if you break your hip and you can't go home, you gotta have rehabilitation, they would have to get approval from the insurance company. Now, while a lot of people in the comments might say they've had some of these procedures and they've been very happy with their Advantage plan, certainly it depends on the insurance company and their customer service and the luck of the draw, I guess. But you could also be facing with that gamble that they're not going to approve it, or you're going to have to file an appeal. Meanwhile, you need that cortisone shot today, and you're going to have to wait a week to see if the insurance company is even going to approve it. So all of these things you have to really consider of what you're getting involved with if you take the Advantage plan. And probably the most disturbing thing about the Advantage plan that you might not want to even try it. In the first year you can switch, I think, before a year passes, to a supplement plan or the Medigap plan without any problem. But after 1 year, if you've been on an Advantage plan and then something does happen and you say, uh-oh, I should have got that other one because I've got high deductibles, co-pays, doctor visits, and all these things that you're going to be looking at. While they may be $5, $10, $30, $40 for co-pays and office visits, there's also deductibles that you might be looking to pay too. Up to $7,000 or $8,000 a year. That's what it comes into. Without getting into the nitty-gritty of what you actually could pay out of your pocket, it can be, I think, around $7,000 or $8,000. I mean, that could break some people. But what I was going to say is, if you're on the Advantage plan and something does happen the second year into it, and you've been trucking along and you've got no additional premium, you got more money in your pocket from your Social Security, you're not paying $200 like me, plus the $30 or $40 or $20 a month for drug plan, you've got it included, you get free gym membership, you're getting your teeth cleaned twice a year, and you're just really happy with your plan. But then something happens, and you're like, oh, I need to get back on the other plan and just go ahead and pay that because more things could happen. You can't. You won't be able to switch. You can try, and what will happen is you have to do what they call underwriting. That means the insurance company that takes over that 20%, the Medigap policies, the ones that cost you $200, well, now they're going to be even more because you're older, and if you answer negatively to questions about you got some kind of cancer or you had a heart attack or a light stroke, they're like, turn down, we don't want you. You are a possibility of us paying money. So unless it's some minor things, you generally don't have a problem switching to a Medigap plan. I've been told and I've learned that it really isn't anything that should scare you terribly about having to go under underwriting after that year passes, because if you're still just on blood pressure and cholesterol pills like the rest of us, it's probably not going to be a problem. But God forbid you're doing it because you're motivated because you have been struck with some kind of illness or, hip replacement and you need more coverage. Yeah, you're going to have a problem. Also, another big detriment to the Advantage plan, and I should have added this in. I'm sorry I'm skipping around, but hopefully you're still with me on this video. And these could be the points. This could be the point right here that you say, no way, I don't want that. All Advantage plans, every one of them, like the G plan is standardized and it covers the same things with no matter what company, and it also is covered by anywhere in the country that any doctor that accepts Medicare. Not like that on the Advantage plan. The Advantage plan is where you live. It's in your zip code. It's certain doctors. It's not him, and it's not him, and it's not even him. It's only this guy or this lady doctor that takes it. It's a group. It's an HMO. I think they might even have PPO, where you're a little bit more able to go, but I don't know about that. I think it's HMO, meaning you're in a group. So how do you overcome that? Well, people will argue that all I have to do is make sure the doctor I've already been seeing is in my Advantage plan, and he could she could be very well be in that Advantage plan. So now all you have to do is select that company to put you in their plan so you can keep going. But like I said earlier, if you're unable to switch and you get a bad illness and you want to go back to the Medigap plan, or you want to have more coverages and not have all these deductibles, and you need to want to travel out of state, they don't travel well, those Advantage plans. You can't go to Johns Hopkins in Texas or wherever it is. I'm just throwing a name out there. I really don't know where they're at. Or you need to go to a special center and you want the best care and it's out of your zip code or even in another state, forget it. It's not going to travel well. Or you're going to have to get special approval or all this stuff. And so you are really limited. That's because the premium is covered and the government is subsidizing these insurance companies and paying these actors, these washed up actors, to beg you and promote it to you and offer you free gym memberships and teeth cleaning so that they can get those policies and make money. The insurance company, they don't care about your health. They don't care that you've got to be going to certain doctors and you're restricted to a fence around you in your zip code. What if you moved? What if you did need to go to another state? What if you're out of state and you get sick? Well, I think in an emergency situation, you're probably okay to go to an emergency room, but it doesn't travel well. And that's a big thing right there. Now, the other side of the coin on that, just in defense of it, to give you if you have a policy now and you're working and it's a group policy, you're already doing something like that. You already have to use certain doctors. But, you're also in a career where you're not, looking to move. You're staying right there, at least while you work there. So you don't care. You just get your little provider booklet out and you need to see an eye doctor or this specialist, that specialist. You call your primary or you whatever, and, you go. It's no big deal. I mean, I'm doing that right now with my Affordable Care Act health policy I have. And I just give I go see my primary or call them up. And, in pretty quick order, they give me a referral. The only problem is I have glaucoma, and the only guy in town is in Delray Beach, and this doctor I have, and I don't really care for him. I don't like his attitude. And he's the only one that's accepting my Florida Blue HMO. I can't just go to any of these other ophthalmologists, whatever they are, the eye doctors, not the eye checkers, but the eye doctors. I don't have any choices. So, but I do have him, but he's impossible to get in to see. And I need this surgery right now that's going to hopefully bring my eye pressure down before I get on my Medicare. I want to do it now before the pressure keeps going higher. And I'm taking these eye drops. And my affordable what is it called? The Obamacare is currently paying for my prescriptions very good. So it's kind of okay right now. And my premium's being subsidized. So there's all kinds of pros and cons I'm not being dogmatic about it, but I'm saying this, folks. That Advantage plan seems to have so many down cons to it versus the pros. I would seriously not consider, when you get to be 65, even going there. Just try to find, if you're fortunate enough not to live in Florida where it's expensive, or New York, or even California, I think those are the most. That G plan is pretty reasonable. I think in North Carolina, I should say, it's only $100 or $125 on top of that $160 you pay for your A and B. And then, like I said, you can get a drug plan for $5 to $40 that covers, if you're only on the minimal prescriptions. And even if you don't even have one of those D plans, you ever heard of GoodRx? It's an app. They save you money on prescriptions and it's free just by using the app. So there's a lot of ways to save on prescriptions. And if your income's low enough, you can actually contact the pharmaceutical provider and possibly get that done and provide it to you at a low cost to no cost. So I wouldn't let that concern you too much. So that's pretty much it. I think I covered everything. You've got the 4 things you need to worry about. A and B, which are together. C is the Advantage plan. D is the drugs. Now with the A and B, you need to supplement it. It's not enough. If you don't want to supplement it and pay the extra money, you get the C plan, which doesn't cost you any extra money and can include all of those things we talked about that the washed up actors are promoting. But then you're restricted to your area, and you could have co-pays and other costs. It could end up being $7,000 to $8,000. But if you don't get sick, it could work out, and you wouldn't be paying, $100 to $200 a month plus a drug plan if you do a supplement plan. But don't go without, because there's a penalty. So you have to sign up. And so I think that's about it. I think I crushed it. And I think that if you're 65 or going to be 65, the 1st of November, or even a few months before, you can Google it as to when you can actually start signing up. Contact any of these people that are on YouTube. They can write these insurance policies from North Carolina if you live in Florida. I'm going to go with this guy I found that's on YouTube. I just like the way he talks. And he explains everything so calmly. And he doesn't dog any one plan. He just tells you, here's what you're going to get, and here's what you won't get, and here's what you'll have to pay to get the Cadillac. It's not free. So just do your research, look at some YouTube videos, take what I said, and then when you become ready to get your Medicare, make sure you crush it.